Hey guys, welcome back to my channel, part 2. Today my patient is going to have a methamphetamine or crystal meth or ice as it is popularly known treatment. He is going to withdraw from ice or methamphetamine treatment, so we're going to provide him the support that he needs, particularly clinically, because if you're going to withdraw from ice, then we don't want severe withdrawal symptoms to happen. The common ones would be headache, hallucinations, depression, anxiety, nausea, and vomiting. Those are the common signs of drug withdrawal. Today, I'm going to discuss with you what are the phases of methamphetamine or crystal meth or ice withdrawal treatment. So this will be just like a talking video, guys. I'll be just facing the camera and I'm just gonna go through with you the phases of methamphetamine withdrawal treatment. So basically in the first 48 hours, this is what we call the most difficult phase of the withdrawal treatment. This is what we call the crash period. Why? Because patient will start to experience the withdrawal symptoms. And what are these withdrawal symptoms? These are sometimes intense symptoms, okay, such as nausea and vomiting, abdominal cramping, sweating, intense sweating, risk of dehydration. So it is very important to monitor patients who are undergoing methamphetamine withdrawal treatment, because there's a high chance, there's a risk of dehydration. So you need to encourage them to drink plenty of water. There might also be a decline with their cognitive or mental state. So it is very important to have that support system present at home, so that whenever these symptoms happen, then the patient will have someone or a group of people that can support them clinically. And if the patient needs to be sent to the hospital, then there are a group of people, there's someone who can assist them with. And this is also the phase wherein the energy levels might go down. Okay, so it is very important to monitor these patients in the first 48 hours of the withdrawal treatment. Okay, so what will happen in the next 3 to 10 days? So day 3 to day 10, patient might suffer severe depression or anxiety. Okay, mind you, some of the comorbidities of this patient, when I say comorbidities, that means they're not only suffering from one medical condition, but they also have other medical conditions. It could be chronic, it could be hypertension, it could be diabetes, it could be that they have other mental health conditions such as bipolar, schizophrenia, psychosis, anxiety. They already have depression. So it is very important for these patients to be supported, not just by those who are giving them the withdrawal symptoms at home, but also the ones that they can usually go to, such as their general practitioner, their social work, or the nearest clinic that they go to whenever they are sick. So in days 3 to 10, the expectation, but although not all of the patients will experience these symptoms, they might experience severe depression, anxiety. They might feel really tired, fatigue, as the body gets used to without having methamphetamine in their body, in their system. So there's what we call equilibrium. So as your body stabilizes and getting used to not having the drugs in the system, these symptoms will start to happen. And some of these symptoms are a little bit severe, okay, especially in the days 3 to 10. You might experience, patients might experience severe cravings for methamphetamine. Why? Because obviously your body is used to have drugs in your system. And for you not to have drugs anymore, then your body, as a compensatory mechanism, your body will say, where is my meth? Where is my drug? Give me the drugs. So you will experience the intense cravings. You will experience some muscle aches as well, shaking or tremors. Okay, that is just a normal body's compensatory mechanism, or the body's how your body will react without having something that your body is used to having. It is the same thing with alcohol withdrawal. Now, what will happen after the 10th day? So we are already in the weeks 3 to 4. Okay, 3 to 4. The expectation generally in weeks 3 to 4 is that the withdrawal symptoms start to subside. But having said that, because your body is still not getting the methamphetamine that your body used to have, you will still have that intense cravings of the drug. You will continue to have that cravings. Your body will continue to ask you, give me the methamphetamine, give me the drugs that I used to have. Tiredness or fatigue will continue to happen, plus or minus depression or anxiety. It is very important to have that support system, not just the support coming from your family, but also clinical support coming from your doctor, coming from any other health professionals out there that can help you with, in case you will experience some withdrawal symptoms that you can't control. What will happen after the 4th week? So what will happen the month after? So that means the withdrawal symptoms start to subside. There will be no nausea and vomiting anymore, although it's a case-to-case basis. It really depends how your body will react to this, because your body is different to my body and different to anybody out there. Okay, so it really is case-to-case basis, but it is expected that 1 month after, 1 month after you've started the treatment, or the patient started the treatment, these withdrawal symptoms start to subside. So there will be no more nausea and vomiting, or just less nausea and vomiting. There will be no more crampings. There will be no more sweating. So in other words, the symptoms are not that extent anymore, or you will not experience all of those withdrawal symptoms. The mental health withdrawal symptoms may subside, such as depression and anxiety, which are very, very common. Now you might be wondering why, because it's been a month since the patient has started the treatment. Why? Because it could be that maybe dopamine is a brain neurotransmitter, may have not returned to its normal functioning. So it is still very important for those patients who are undergoing a methamphetamine drug rehabilitation treatment to be monitored clinically by their doctor out in the community. So there you go. I've just given you a brief idea on what to expect when a person undergoes a methamphetamine or ice or crystal meth drug withdrawal treatment. So these are just one of those drug treatment that we provide to our patients. Okay, so obviously there's some cocaine, heroin, alcohol, benzodiazepines, and probably the most common treatment that we do in this in the drug and alcohol center is alcohol. Alcohol probably comprise to about 80 to 85% of the treatment that we do in the community, in the center, as well as in the hospital. Emergency department in the hospital encounters probably 80 to 90% of the alcohol and drug presentations are mostly alcohol related and not drug related. So I'm just gonna go to my desk. I'm here in one of the consulting rooms because I've got a meth patient today that I'm going to start a methamphetamine drug withdrawal treatment. So I'm just gonna write some prescriptions. I'm just gonna call his nominated pharmacy so that I can liaise with them.
A few moments later.
Oh no! I was looking for my coffee mug. Can't find it on my desk.
Oh no.
So I'm going to the kitchen to see if it's in there. Let's have a look around. It's not here. No, it's not there. Where is... Look at these guys. We've got these live plants in our kitchen. And then look at that birdie there. They're not able to see us, guys, because this glass window, this is tinted. So they can't see us inside, but we can see them outside. This street here is known to have few people dealing with drugs and all those stuff. So we see police people from time to time, doing their rounds here just to make sure that this alleyway is safe. But once they know that there's no police, then they deal drugs in this area. Okay, so but we're safe in the office. We're safe in the office. That's why I said this window here is tinted. We can only see them, but they can't see us. Okay. Oh, I haven't seen them. I haven't seen this. Someone gave a potted plant and it says, "Thank you, task force team." Wow, nice. All right, because sometimes I put my mug here if I still have a leftover. Okay, it's not there. No, it's not definitely there. This is our first aid kit here area. Look at that. See? Oh my, where is my mug? It's here, it's hiding. It's hiding, guys. So I forgot to put it back on my desk. So it's here. We'll clean it and we'll have some coffee. What is it now? They're fighting. Also, guys, as a health professional working in this field, there's always something new that is evolving, and you need to update your knowledge and skills in order for you to be at par with other health professionals out there, giving this very important care to patients who are affected by drug and alcohol. So it is very important to update your knowledge. It is very important to update your skills in order to be more effective when it comes to treating and looking after your alcohol and drug patients. So as a result, I have enrolled myself to a seminar. I'll be attending the Victorian Alcohol and Drug Conference here in Melbourne next month. So I'm so excited. I'm gonna show you this. That's it. I'm finished. Let's go.